Hello, Dr. Selyne Samuel. I am a breast surgical oncologist with Premier Surgical Oncology here at Premier Health. So first, let's talk about breast cancer screening. Women should start receiving their breast cancer mammogram screenings annually. That means once a year starting at the age of 40. You should also undergo an annual clinical breast exam. That means a breast exam performed by a physician or advanced practice provider. Women at high risk for breast cancer need a screening mammogram as well as a breast MRI. Those women at high risk for breast cancer also need biannual clinical breast exams. That means they need a breast exam twice a year performed by a healthcare professional. All right, so let's just talk about some of the risks that increase a woman's risk for breast cancer generally. And there are risks that can be controlled and there are risks that cannot be controlled. The risks that cannot be controlled are literally just being a female. And that's a risk factor for breast cancer. The other risk that cannot be controlled is older age. Unfortunately, we also cannot control our family history, nor can we control having a genetic mutation. We also can't control fertility, which means how long has a woman been reproductive or has she ever been reproductive? Now, the factors that can be controlled are our weight. Studies have shown that obesity increases the risk for breast cancer. Also, excess alcohol intake increases risk for breast cancer. Also, having been on hormone replacement therapy for an average of 5 years or more increases a woman's risk for breast cancer. And these are risk factors that can be controlled. How can a woman determine if she's at high risk for breast cancer? That is based on multiple factors, such as your family history of breast and/or ovarian cancer, or whether or not you have a genetic mutation. And some patients don't know if they have a gene mutation and actually need to meet with a healthcare professional to undergo assessment and testing to determine if they have a genetic mutation. Other patients at high risk for breast cancer are patients who've had an abnormal breast biopsy, such as a breast biopsy that showed atypical cells. Women with previous chest wall radiation are also at increased risk for breast cancer. Also, women who have dense breasts, unfortunately, are at increased risk for breast cancer. Let's shift gears and talk about some of the truths and myths about breast cancer. Some truths about breast cancer. Exercise and a healthy diet can decrease your risk for breast cancer. Less alcohol intake also decreases your risk for breast cancer. Being on hormone replacement therapy for 5 years or less will help decrease the risk for breast cancer in the future. Being overweight increases the risk for breast cancer. Not all breast cancers will show up as a lump, which is why it is really important to get your screening mammograms done in a timely fashion. Also, not all breast cancers are treated the same. And this really depends on the biology and a lot of other factors that are taken into account regarding that particular patient's cancer diagnosis. Some myths about breast cancer. No. Having large breasts do not increase your risk for breast cancer. Using deodorant does not cause breast cancer. Also, mammograms do not cause breast cancer. The amount of radiation that we get from mammograms is very, very minute. Wearing a bra with an underwire does not increase your risk for breast cancer. And unfortunately, breast cancer does not affect just older women. We have younger patients who have breast cancer as well. Despite the fact that women may not have a family history of breast cancer, that does not mean that they will not develop breast cancer in their lifetime.